Yonas Tegegn Woldemariam, and a team of the Secretariat and men and women who have worked so hard in putting this together to realize that vision of a malaria-free Uganda by the year 2030. To the listeners and our international partners who are online, we welcome you all and we thank you for joining in. When I last checked the numbers, we are growing bigger and bigger every minute. And the time has come for us to talk and discuss malaria. I've already introduced one of the people we are going to have a very good candid discussion about malaria, who is a panelist, our host at the ministry headquarters, Dr. Diana Atwine. If you can wave to your people because they are seeing you. I've already introduced the WHO country director. I will introduce the board. Amidst us, we have one of the prominent Ugandans, a businessman, a person who has inspired so many, and a person who is so passionate about malaria, Dr. Patrick Bitature. I'll, in a few minutes, introduce the entire board because we couldn't all converge here. We have Mr. Solomon Osia from Ocean Malaria Partners. We have Mrs. Lilian Ajarova, who is also the CEO of Uganda Tourism Board. We have Mr. Fabian Kasi, the CEO of Centenary Bank. We have Ms. Julie Chokunda, the CEO of Uganda Biodiversity Fund. We have Engineer Harrison Mutikanga, who is the CEO Uganda Electricity Generational Company Limited. We have Ms. Prosi Nabanja, who is the CEO Uganda National Oil Company. We have Mrs. Sylvia Arinitwe, who is the Deputy Managing Director, National Water and Sewerage Corporation. And we have Dr. Bildad Baguma, who is the Managing Director, Joint Medical Stores. As chairman, I have a deputy or the vice chair, who is Barbara Murana, who works with Nice House of Plastics, but she's also the chairperson of Uganda Manufacturers Association. And that is the team which is going to drive us in realizing our vision and dream of a malaria-free Uganda in line with the Ministry of Health and the government of Uganda in the next 10 years, and that is by 2030. I'll have a brief about Malaria-Free Uganda. Those of you who are just joining us for the first time, it was launched by the Minister of Health, Honorable Dr. Ruth Acheng, on the 2nd of September. We are working with the private sector foundation, and you've heard from the composition of the board, people from the civil society, and selfless men and women who have said, we are going to carry that burden using our time and resources in realizing our goal. So Malaria Free Uganda is a private public sector partnership for sustaining national malaria response that has been established under the auspices of His Excellency, the President of the Republic of Uganda, who committed to a malaria-free Uganda during the launch of the Uganda Mass Action Against Malaria Initiative and the Uganda Parliamentary Forum for Malaria. We also have people we've been working with over the time as a secretariat, and I'd like to thank ALMA, which is African Leaders Malaria Alliance, which is currently chaired by President Uhuru Kenyatta of Kenya. It is a seat which is rotational, but African leaders together say they put resources to work with organizations like us in meeting our goal and target as Africa of announcing Africa malaria free. When we are launching, I talked about polio, the certification we have just received, and I'm happy Dr. Yonas is here, which takes 3 years that we have a polio-free Africa. The journey we have started is going to take us the same way, that our dream is going to become real with the support from the Permanent Secretary who is here, with the support of WHO, with the support of the different corporates all over Uganda and international partners. We are going to make sure that we reach all corners in Uganda where malaria is endemic and where so many lives are lost on a daily. We lose over 16 people every day because of malaria. The way we've saved so many people from being crippled is the same way we are going to save as many lives. Mothers, children, but even adults. But even the effects we suffer from at the workplace every day. Absenteeism because of malaria is the reason why we are here this evening. So MFU is real, and later I'll call upon the corporates who have joined us to commit their support towards this fight against malaria. Allow me to invite our Permanent Secretary, Minister of Health, Dr. Diana Atwine, to say something as the first panelist and as a person who receives reports every day on her desk about malaria, and as a person who is going to give us and be very key and critical in leading and making our dream real.
Hi everyone. We welcome all of you, those online and the board members representing entire board, the Free Malaria. I want to thank you so much for this initiative. I want to thank you for the keen interest that you have shown. I want to thank and welcome World Health Organization representative that has been here all through with us, not only for malaria, but even for other conditions. And so we are very excited that malaria is gaining the attention, is getting the attention, because before it was an issue of health. It was an issue of Ministry of Health and WHO and the health key players. But we are very excited to know that this time around, the private sector has interested itself. The other players like the Rotarians that have been supporting even in other areas are becoming very key and in this discussion. So first of all, I want to welcome you, all of you, for spending this time amid so many competing activities, but you are able to come and join us this webinar. The question would be, why Uganda? Why now? According to World Health Organization, Uganda has the third highest number of malaria cases globally, and that is 5% of the global total. In 2018, there were 5.8 million confirmed cases of malaria, and between 2016 and 18, a case of malaria was confirmed on average every 3.5 seconds. This burden reduces ability of health facilities to absorb new health threats and epidemics like COVID and other outbreaks. In Uganda, malaria is responsible for 30 to 40% of outpatient visits 15 to 20% of hospital admissions, and up to 10% of inpatient deaths. That is very high. Even it supersedes so far the deaths of COVID as of now. Children under the age of 5 years old are at the highest risk, accounting for two-thirds of malaria deaths globally. The pregnant women who are unable to take the most effective antimalarials are also particularly vulnerable. Yet the percentage of pregnant women receiving preventive care remains low despite an increase in number of seeking antenatal care. And that is attributable mostly to lack of information, but also lack of involving every leader out there to raise their voice. On average, malaria causes 37% of workforce illness and absences and costs Uganda more than 22 million days of work per year. This is the equivalent of removing 90,000 workers from the labor force each year. Therefore, malaria reduces Uganda's economic resilience and ability to recover. Rural households spend up to 25% of their annual income seeking treatment for malaria, resulting in decreased economic instability and also an increase in poverty, because many of these spend more time at the facilities, especially women. And of course, men, some men spend more time drinking. So what happens, the productivity is reduced. Despite this heavy burden, significant progress has been made in the last few years. We have seen increased political leadership commitment. We have seen right from the head of state, we have seen the members of parliament, and also private sector come on board. Why is malaria? Why is it that we are emphasizing malaria, not any other disease at this time? As I had mentioned earlier, the burden is still high, although we have made some strides. We see 14 people die every day, and therefore that has an impact on the well-being of the families and also economics. Malaria epidemic could overwhelm the whole system if we don't act. I was looking at the resources that we put in buying medicines for malaria every year. It contributes to 1/3 of entire budget of Ministry of Health for commodities. And that is a big strain on us. The progress has been made, and we want to thank all the players. We want to say that we have seen reduction of malaria prevalence by 80%, and that is reduced from 42% in 2009 to 9% in 2019. Mortality equally has reduced from a high of 20 per 100,000 population in 2016 to 9 per 100,000 population in 2019. The incidence of total malaria cases declined from 460 per 1,000 population in 2013 to 100. But that is still very high compared to other countries that have made big strides in control of malaria. And for us, we have set our target high. Therefore, we want to see this number reduced significantly. Gradually, we are engaging other health-related sectors in the community. And so we do treat malaria alone, single-handedly. We have tried this, it didn't work. But we welcome you all. Want to welcome different initiatives that have been established. We have seen Mass Action Against Malaria initiative that was launched and is being implemented with related other activities. We have seen Uganda Malaria Parliamentary Forum and multi-sectoral engagement. We have seen even the effort through music, dance, and drama that has been implemented by Ministry of Education, Uganda Multi-Sectoral Action Framework and Mainstreaming Malaria into national and district plans. And this, starting with this year, we hope that Ministry of Finance and even National Planning Authority makes it a big thing, even in the budgeting and the activities as we are mainstreaming in all government MDAs work plans. We want to see this take root, and we hope that beginning with this budgeting cycle, it is going to be an issue that we want to raise with everyone who matter to make sure that it is a priority in our mainstreaming activities. We know that if we do that, that will increase awareness. It will raise the consciousness of the activities as even each MDA in government, as they are planning, as they're implementing the activities. We have actually been discussing that even before we go into budgeting, we have to bring on board all the permanent secretaries, and we go through the strategy that we made to make sure that everyone understands and look at the milestones and set the milestones that they want to achieve as far as the prevention and control of malaria. Therefore, the budget call circular 2019 for 2021 fiscal year and beyond, Minister of Finance joined Ministry of Health to mobilize complementary budget malaria response resources. And Ministry of Health guidance, we were looking also at the private sector strategy for malaria prevention, control, and elimination that has been developed, but now we need to roll it out and implement it. The funding. It has also been observed that foreign funding represents a substantial proportion of the total malaria budget. For this, we want to recognize and appreciate the key funders, that is Global Fund, PMI, DFID, UNICEF, WHO, among others. The gradual transition of funding from foreign funding and a foreseen 21% decline from other external sources will leave a significant gap in financing for malaria programming. Therefore, we want to ensure that at least 90% of the population at risk are protected through appropriate vector control and chemo prevention measures. And these measures are very expensive because ever since the partners pulled out in some of these areas and government committed, we have seen that it requires real commitment, and also dedicating resources. And it has to be continuous. It can't be one-off, and then we retract, we will not be able to achieve what we want to achieve. Countrywide long-lasting insecticide-treated nets that has been also implemented, and we are in the process of distribution, because our aim is to achieve universal coverage. And this will cost us $136 million. Continuous distribution of long-lasting insecticide nets to pregnant women and also under 5 years of age. It is costing us about $50 million. The regions with high malaria burden and the high transition will be targeted by doing what we call indoor residue spraying at least once a year. And this alone will cost us $144 million. That is quite a lot. And so we are looking at, if we, God forbid, if the partner has now said, okay, go ahead, go and sort yourself, we need to look at a backfall, like fallback position, because we have depended on external funding all through. And therefore, this time around, we want to see how we can generate resources within the country, mainstream activities that can prevent malaria, and also ownership, so that this is a burden for everyone. We're also looking at larviciding of urban cities and cut corridors, which will cost us $24 million. Chemo prevention, which includes intermittent preventive treatment, the countrywide, that is $3.3 million. So if we are to ensure 90% malaria cases reduction, we need to do a lot. We need to bring everyone on board. We need to call upon everyone who matters, not only contributing financially, but also making sure that wherever we are, whatever office we are, whether in the private sector or the public sector, we put in place activities that will mitigate this burden. Why Malaria Free Uganda initiative? This is a private-public partnership. We as government of Uganda cannot do this alone, as I mentioned, alone. We need everyone to come on board. We need to engage a structure, an efficient structure that goes down up to the household, without targeting the household, without ensuring that everything that we do is targeting that very household in the village, then we'll not be able to do much. We also want to leverage on resources of Malaria Free Uganda initiative. We want to take advantage of your goodwill, or want to take advantage of your networks. We want to take advantage of your scalability, because we know that you are connected, but at the same time, you have also the structures up to the roof. If we talk about, for example, the Rotarians, the structure is enormous. If we talk about the private sector, the structure is enormous. So we will really want to leverage on this structure. Government of Uganda is committed to supporting Malaria Free Uganda. As I had mentioned earlier, we have adopted a multifaceted approach to malaria control. One of our biggest vision and all activities that we are planning, they are all looking at malaria as one of our biggest priorities in the Ministry of Health. Therefore, anyone that comes along to support us, we welcome wholeheartedly. As long as malaria remains a big public health problem, we shall continue to stagnate economically. There is a very big connection between economic growth of a country and high disease burden. If we reduce malaria, we increase the productivity. We increase expenditure, huge expenditures on treatment and all these things I've mentioned. We shall see the GDP grow. We are donating so much money to the manufacturers of these medicines. We want to see all that money retained in the country, and it helps us to grow economically. Therefore, we want to thank you so much today for joining us. And we do believe that this journey we have started, it is a noble journey. I can assure you will not regret. And I want to tell you that we are more than committed, because what encourages us is that we are not alone. We are with the head of state, we are with the partners, and we are with all of you. We thank you so much. So we are here really to discuss how we can move this forward, how we can raise resources, how we can strategize together, how we can mainstream our malaria activities into our workplace. By doing so, we'll definitely achieve so much. Thank you so much, and we welcome you all. God bless you.
Thank you very much. Our not achieve much without strong partnerships and relationships with government. And we are so honored as a team and as a board that the Permanent Secretary has recommitted the ministry's support in realizing a malaria-free Uganda. The best news coming from our PS is that under the coming budget, malaria is going to be one of the biggest priorities. So we are more than excited. But also we cannot have impact in communities without the support of government, development partners, but even the communities within Uganda to understand that malaria is real. We have just been running a campaign with the Ministry of Health. Dr. Opigo, you know where the message was that the mosquito is not under quarantine. So they continue coming to us, and with the different challenges we've had, increasing the level, water level in Lake Victoria has brought more stagnant water around communities, even where the Ministry of Health had worked so hard, and WHO, in bringing malaria to a level of 1%. It has gone up, and every day we listen to people saying that they have not worked, they have lost lives because of malaria. So this is very good news, and we thank you once again. Our Permanent Secretary, convey appreciation to the Honorable Minister and the entire team we work with every day. We've worked with Dr. Opigo from the time we started this idea of having a malaria-free Uganda. We've worked with WHO in putting together brains on how we can work together to save as many lives as possible. Friends, our next panelist is Dr. Yonas, who is the country representative of the World Health Organization. He has his own message about malaria, and being a key ally and partner, we are waiting the good news coming from his presentation.
Thank you, Chair. Thank you, PS, for your messages. I hope people can hear me well. First of all, I think Uganda is in a special stage now. As you know, 2 years ago, we had a surge in malaria, but by ensuring the commitment of government and the community and the full commitment, especially of the government, from the head of state, the parliament, and the launch of the MAM project, I think Uganda is proving to the world malaria cannot be only controlled, but at the end of the tunnel, we can eliminate that. You might ask me, why is WHO interested? We are a membership organization. So our major commitment is to call attention of our member states on the burden of a disease, and in this case, malaria, and the burden globally, regionally, and at national level. We have also responsibilities in providing knowledge, collecting the knowledge, synthesizing it, and providing guidance on member states in terms of malaria control, elimination, or otherwise. According to the 2019 World Malaria Report, that's one thing we do, compile data from all countries. And we saw that there was exceptional control effort between 2000 and 2015. That was driven by the Millennium Development Goal, the Global Fund putting, and other partners putting a lot of funds. And if we look into some of the achievements, in 2000, we used to have close to 321 million people getting sick of malaria. By 2018, we have dropped to 228 million. And when we compare the deaths, it dropped from 995,000 to 403,000 during the same 15 years. Unfortunately, the growth since then has not been as dramatic as we would have expected it to be. But at the same time, we have seen a number of countries which have low burden of malaria moving from malaria control to malaria elimination. So when one sees, for example, we were looking at about 5 million cases dropping between 2000 and 2015 per year. But that change has dropped to only 3 million between 2018 and 2017. And although the global target was per 1,000 malaria cases dropped also, not very significantly. It dropped from 71 per 1,000 population to 57. What is worrying is that 93% of malaria cases in 2018 are in Africa. So Africa is disproportionately affected by malaria. And it gets worse when we look into the most vulnerable population, children and mothers. 2/3 of pregnant women, who should get IPTAPs, do not get it as they would have expected when they go into antenatal care. And we also see that generally when a child with fever, they have to go to the hospital and be investigated. And we see that 2/3 in the sub-Saharan, 36% do not receive any medical attention. So if they don't see medical attention, we will not be able to even know which one of these are in malaria. in most cases, they turn out to be upper respiratory tract infection and malaria. So we are missing those things. As for the national Ugandan situation, I think Dr. Diana has really elaborated where Uganda is. So where are we? Globally, pushing for elimination of malaria, there is a global technical strategy which has been drawn for 2016 to 2030. The purpose of this is to see the world without malaria by 2030. So time is running. In 10 years, we have to make sure that hundreds of millions of people do not have malaria anymore. And this is, we have looked into, the African health ministers have committed in 2016 at heads of state level, at the ministers level, to eliminate malaria and do all the effort. Unfortunately, as the permanent secretary already said, Uganda is one of what we call the high burden countries out of the 11 high burden countries. But at the same time, we see the potential in Uganda. So part of the global movement in malaria has included Uganda in what we call the 11 high burden, high impact countries, where intervention has shown that they can make a difference. What is this high burden, high impact initiative looking at? And most of it has been fulfilled in Uganda, in principle. Uganda has shown that it has a strong political commitment to get rid of malaria. I think I have served as representative in 4 countries. I haven't seen so much commitment in eliminating malaria as I have seen here. There is a great effort to use evidence as well. If you go into the Ministry of Health website, and if you look into the health information, there is a great wealth of information which tells us in a very detailed way where we have to concentrate, what we have to do. And the other thing which we are looking into is this initiative, when looking into 11 countries, is also looking into the specific country context. And the specific country context here is getting even richer with the engagement of your initiative of Malaria Free Uganda, the engagement of the private sector, in addition to the political commitment. And the fourth important component of this high burden, high impact initiative is a well-coordinated partnerships. So the government has a responsibility, but coordinating is not just something by declaration. It's not because the parliament has a committee that the whole nation has to go that way. It is based on commitment. And to see really the private sector getting commitment to make sure that Uganda eliminates malaria, and we see malaria-free Uganda requires your commitment. And it is something which, as a global mark, I think one of the things I should tell the audience and you is one of the things we have been championing and telling the world is Uganda has got it right when it initiated the mass action against malaria. Ensuring that the political commitment is also related with measurable indicators, asking the parliamentarians and others to make sure that the effect of malaria control goes to each and every house. The constituency asking the commitment of the political leadership and asking their achievement is important. And I think the private sector coming into that is important, and coordinating this is important. So you ask me, what does it take for Uganda to be malaria free. As you know, one is be resolute on your vision. It's not something which is not achievable. So if everybody, the private sector, the government, the political sector, is committed, we can achieve it and maintain it. And it can be done. Last year, 2 countries have managed to eliminate malaria. One of them is in Africa, Algeria, and the other is Argentina. So there are 38 countries in the world which has eliminated malaria. They had it, and now they don't have it. And it doesn't take lots of money. Sri Lanka achieved it when it was still one of the least developed countries in the world. It's a commitment and engagement of all partners, most of all the community. And half of the community is with you, the private sector and the partnership. The other is mobilizing resources. And when I say mobilizing resources, it also means not only financial resources, not only in-kind resources, but knowledge also. Data is also a resource. And resources has to come with accountability on utilization. So that's the other important thing. We have called, our Director General has challenged the world that we should eliminate malaria, what we call the malaria challenge. We didn't succeed much, but there is a progress. In 2018, our estimate was malaria control and elimination would require about 5 billion. Globally, what was mobilized was only 2.7 million. So it is, there is a need for resources. The other is using data and ensuring data is not useful unless you use it. And most of all, it's not only the Ministry of Health, the private sector, which has to use the data. It's every individual has to use that data. If we make it available, people will know where to take precautionary medication, where to use insecticide, long-term insecticide impregnated bed nets. So I think information is the other area where we can make a lot of advances. And I think this is just like we were boasting throughout the malaria experts in the world saying, Uganda did it by ensuring that the MAMS has been launched. We are going to do it again by saying the private sector and the non-governmental sector, the civil societies and others, have committed for Malaria Free Uganda. And I thank you all, and you can rely on our full support. 2 things I want to mention. Malaria resistance is developing in Asia, in Cambodia and so on. Malaria resistance coming to Africa is going to be deadly. So our time is limited. So we have to act fast. So if we eliminate malaria, then the resistant malaria will not be a problem. And resistant malaria, I have been a representative in Thailand. I have seen how resource-intensive malaria resistant could be. We have to avoid that. The second point to the private sector is it makes business sense. If your employees don't take leave, it makes business sense. If the economy grows because it's not pulled back by malaria, makes business sense. Because the population is your market, the population is your workforce. And thank you for taking this initiative.
Thank you very much, Dr. Yonas. Friends, we've heard that we have to move from what we've been doing as a control, but also to start thinking about eradication of malaria. And this is the reason why we are here, bringing so many brains together in achieving that goal of a malaria-free Uganda. He has shared about the actions he expects from us, but even committed the support from World Health Organization in realizing this dream. We thank you so much, and we'll be knocking at your door every day because we've developed this partnership because of that campaign of a zero malaria world, and how to celebrate by having Uganda coming out of those top 10 nations which are more endemic because of malaria. Our next person to share is a person who has even walked his way to State House in Entebbe to discuss with the president about malaria and how we must find solutions in fighting against malaria. He is a businessman, but he's also on the board of Malaria Free Uganda. Allow me to invite Dr. Patrick Bitature, a director who sits on the board of Malaria Free Uganda, to tell his story on how we must fight malaria and why we must do it urgently. Patrick.
Thank you, Ken. Mugisha, thank you very much. Madam PS, Minister of Health, Dr. Diana, Dr. Yonas, thank you so much, Dr. Piga. In by thanking those key actors who have brought down the incidence of malaria and prevalence of malaria in Uganda. Uganda has made huge strides in this fight against malaria, and it's easy to take it for granted. But the PMI, Presidential Malaria Initiative, mainly the Americans, the global funds who contribute so much for us to fight malaria, DFID, and so many others. I cannot go naming each and every one of them, but there are so many development partners who have really walked this journey with us. But I must begin by thanking His Excellency the President, who has led this war in Uganda. We called it a war, and it's been a war. The people in the Ministry of Health, key players, and thank you all for the role you have played. I'm delighted that Ken Mugisha, our chairman, who is my governor with the Rotary Club, he's known as a Rotarian, and he's at the helm of the Rotary leaders in the region. I am glad he's leading us because we all mean well. But then it needs that commitment that is so unique. That's why I respect these Rotarians who meet every week, be it for 1 hour, religiously, they make the time, and that shows commitment. And they have made such a difference in people's lives. It is a selfless act. So I thank all Rotarians for joining us and making this initiative what it is. So today, as I end, I'll be calling on the rest of the private sector, not just the Rotarians. It is our duty, it is our responsibility to join and fight this war. I call it a war, just like His Excellency called COVID-19 in his very first address to the nation, that we are at war. Because indeed, we are at war. When somebody is on the other side, on the offense, and trying to destroy you, decimate you, kill you, then you've got to protect yourself. And first thing you do, of course, is stand still and study the enemy. Now, with COVID, the government has made huge strides. We've done very well compared to other countries. With malaria, we've been at war for at least 50 years because that's the time I can remember. Me, I can say, I remember. Before that, I was probably too young and I didn't know what we were doing. But the last 50 years, we have been at war with this malaria, but we are not winning. We've made strides, but it should have gone. I feel very strongly that we should do much more about malaria. When you're at war, you need a shield to protect yourself, and you need a spear to attack. We discovered lately that the best shield were these mosquito nets. And the government, with the development partners, have focused on mosquito nets to shield us from this malaria. Because we know, we have studied this enemy, it is the Anopheles mosquito, it is the female one that is the biggest enemy. Other mosquitoes we will probably live with, but we've got to get rid of that deadly one. It is even cited in the Bible and the Quran, a very deadly disease. So we've got to be aware of this disease. Now, we've got the shields, and we thank our development partners because the mosquito nets we have are treated mosquito nets, and they are priceless. They are fantastic to use. They have really helped us. we need to make sure we raise awareness that everybody sleeps under a mosquito net, especially, and I say especially, the children. Because children under 5, they don't know what's wrong. They can't even describe what's happening to them until their temperature is extremely high. Then you're rushing them to a hospital. By the time that happens, the damage to their brain, they'll never tap their full potential if they get serious malaria. I'm not a doctor, and I'm not going to go into the statistics. The very authoritative people have spoken from the World Health Organization and our Dr. Diana here. So I'm not going to repeat any of that. But I want to tell you why I am so passionate about malaria. I started encountering malaria maybe in primary school when you're a kid, you don't take it seriously. But when I went to Namasagari School, Namasagari College, I got malaria nearly every single term, but so did most of our students. Every term you get a new bout of malaria. I was there for 3 years, and every term, that was like 10 times you've had malaria, and it's quite debilitating. It paralyzes you, it messes up your studies. So for me, it was very personal that one day we should fight back this malaria. And that's why it has stayed close to my heart that we've got to deal a blow to malaria. Now, there's a correlation, a strong correlation between financial incomes in the amount of income in every household and the incidence of malaria. So people have got to find a way to increase their household incomes if we're going to deal a decisive blow to this malaria. Also, if we have malaria, it will affect our incomes. It hits back also the other way. So we've got to find a way that we do this effectively and leave nobody behind. In Kampala, the incidence has come down considerably because most people are reasonably well off. And somehow they can find a way to deal with it. But is that fair to our societies? A society's level of progress is measured by the weakest people in your society. Now, if the weakest people are left behind, what are we saying as Ugandans about our people, about our country? We need to focus on fighting malaria. Recently, the last time the Pope was coming to Uganda, he was asked what is his worry because he's coming to Uganda. And some of those Western media houses were trying to make it like there might be terrorism or insecurity, there's war in the middle of Africa. The Pope told them he's not scared of this. He's not scared of terrorism or anybody to assassinate him. He was scared of one thing, the mosquito. That is on record. Yeah. He was scared of the mosquito. Why? Because the mosquito has killed several popes before. This thing does not discriminate. It is on record. I think one of the popes I remember is Pope Gregory, who was killed by malaria. So people have been scared of malaria, but somehow it has remained. We have dealt decisive blows to other diseases. We have made huge progress, but somehow malaria has remained elusive. Indeed, we've made strides, but not enough. What do we need to do to make a difference? And why now am I calling upon the private sector? The last I was showing the analogy of comparing COVID to malaria and said that if we are losing approximately 14 people per day, in 1 week we lose 84 people. In the last 6 months, Uganda, we have lost 62 people approximately to COVID. But we have spent billions and we're all scared, we're up in arms about COVID. We're dressed like this, like we're from another planet because of COVID. We need to decide we've got to take action around malaria, and we can't postpone it and say, let's deal with it later when we have dealt with COVID. So today I make a call, not just to the business people in the private sector, but to the more important people, our religious leaders. The religious leaders can play a vital role. The cardinal, the bishops, the pastors, the chief cadi, and all the leaders in the mosques. If we all get together and send out a signal, because you have people who believe in what you say, you have led us through so much, you have held us together when we are vulnerable. Help us work together to send this message of raising awareness in this fight against malaria. If we do this together, we shall overcome. We've given ourselves 10 years so that by the year 2030, we can hit target. But I think we can do it much sooner if everybody did this, and Ugandans would be proud. We have broken records before. Why don't we go for this one? I call upon the hotel industry players, because we're talking about tourism. Today is World Tourism Day. What are we talking about when malaria is the thing everybody, even the Pope, is scared of? We can do all the nice things, build the beautiful lodges, we have the animals, we have the beautiful Ugandan features that make Uganda gifted by nature. But unless we contain malaria, it is a huge impediment to the tourism industry, to the manufacturing industry, to every other sector in the private sector. Somehow or the other, we are affected by this malaria. We need to find a practical or pragmatic solution to overcoming it. We can't leave this to the public sector. They have done so much, but it's a time that the private sector rises to the challenge. And we cannot continue saying that we are one of these highly indebted countries. They are called HIPIC, highly indebted poor countries, or highly burdened countries. Those names, they may make them sound good, but they are shaming to us. It is our civic duty as Ugandans to move away from these nice names and be a country that is proud. They have said to you, Algeria has done it. Argentina has done it. Sri Lanka did it when they were still earning much less than we are earning. And their tourism has flourished. Look at Sri Lanka's tourism. It is booming. So we need to do things that actually have a direct impact in the way we live. Otherwise, this socio-economic transformation we talk about will remain elusive. My thinking is, number one, we raise awareness. Let's spend some time raising awareness. Let's focus on it. When I call to the private sector, I'm not saying bring your money now. It's good if we have those resources, but we must raise awareness so that everybody knows. Mosquitoes fly, attack mainly at night. From 6 p.m. in the evening to 6 a.m., we must really protect our people, especially children. During the day, we're not as vulnerable, but at that time, those small mosquitoes are annoying. And the way they bite you is to warn you that we are coming for you. They come for your blood. Number two, we shall raise resources. Once we raise resources, and that shall be a collective effort, slowly but surely, let's begin today, raising resources. And resources, like Doctor said, is your data, is your time, is your effort, not necessarily only money. So let us focus in joining this fight. Number three, a call for action. Action for all. Let us leave nobody behind. If we work collectively, I am sure we can give this disease a final blow that sends it away permanently. We can break that cycle, because once it is broken everywhere, and in those areas where it is very high, in West Nile, Katakwi, some areas in Soroti, Karamoja, why is it there? It will keep coming back. We've got to make sure even your neighbors don't have it. You can't be safe in your house if your neighbors got malaria. It's something we must work together to make sure we deal with this thing alone. I'm calling upon the top management of Umeme. Whenever we are running our adverts in Umeme, we must see this as a partnership where we shall work together with Malaria Free Uganda, so that to make sure that we raise the awareness. That is the first phase of this initiative, and we must make everybody aware that malaria is a problem, and it's a problem that we can overcome. I thank you.
Thank you.
I would like to thank my brother, Patrick. He has always been a beacon of hope. We've appreciated his efforts in saving lives, in making a difference in people's lives. And he has seen malaria as one of the most challenging in his life as a human being. He has talked about his life at school in the Masagali College. And to date, Busoga is among the districts in Uganda where malaria is still a pandemic and endemic, killing so many people. So Patrick, with that commitment, you sit on several boards. It is time for each and every one of us to move out of our comfort zone and look at the children in Karamoja, the children in Katakwi, the children in Gulu, the children in Lira, that they're also human beings who deserve to live. The team which is here this afternoon and evening is going to look at each and every one of us, the corporates, the business people, joining hands together, raising funds, creating awareness, promoting advocacy in every corner of Uganda, so that in the next 10 years we celebrate together. True, we are going to do it with a political will. with the support from our donors and partners. Tomorrow, I'm traveling to Arua, and this is because of being selfless. I'm not paid to go there, but we are going to launch planting mosquito repellent trees in hospitals, in schools, and in every corner, including homes. We are going to develop nurseries in places where malaria is more endemic. So we are going to combine the environmental attitude together with a lot of advocacy in ensuring that we reduce the death in those regions where we lose people every day, where malaria is at over 33%. And the corporates who have joined us online, it is time for us to wake up that when we are drawing our budgets, when we are talking about CSR, we should look at the causes of death in Uganda. Malaria being one of them. Losing a minibus every day because of malaria is not a small thing. But also, Patrick said, as a businessman, in the tourism industry, we lose so many tourists who listen about the good things in Uganda, but we lose them because of that thing called the mosquito. That they know the mosquito will come and attack them, and they might never go back to their countries, having come to enjoy the Pearl of Africa. The Pearl of Africa is real, and it is the Pearl of Africa which we are trying to protect and make it better by having it attractable to investors, to guests and visitors to come and celebrate and enjoy Uganda without expecting a mosquito to attack them. So there are so many interventions we are going to have. I would like to thank the panelists for having spared your time. Dr. Diana, for opening your doors. You're going to open more doors. Have a very big budget for Malaria Free Uganda, because this journey is what is going to define you as a great leader and a great woman. But being a mother, you also feel touched when you see children staying at home, missing classes because of malaria. We have a few minutes because by 6:30 we must close. I'd like to recognize some few people who have accepted to be part of this journey. We have a Janta farmer, which has pledged in supporting a malaria-free parish. For them, they are going to concentrate on an area where malaria is killing so many people, people are falling so sick, to become a case study that true, we can have a zero malaria Uganda. We also have ALMA, which has committed to support partly our secretariat, that is the African Leaders Malaria Alliance, which is going to support, and it has been supporting the secretariat. We have Rotarian Malarias in Seattle, USA. They are going to support the startups for the nurseries spread all over Uganda, but mainly to concentrate in those areas where mosquitoes are more prevalent, by bringing in resources in those areas so that we plant and donate those seedlings to the communities, but also to support advocacy, because we can plant these trees, but we shouldn't just plant. We should grow them. So it takes a lot of time to convince our communities not to release their goats on the trees we have planted to save their lives. So many other corporates have committed. I don't know whether there's some online, but later we are going to invite them to commit. But Patrick will give you a letter for Meme, but also Simba group of companies. Patrick, I'll share with the people listening in. Patrick has shared with me that for the rest of his life, starting a few months ago or a year ago, he has committed his life to extending humanitarian service to community by using his resources, his and resources, to save as many lives in the world as possible. So when I listen to Patrick say something, I know he means it. And he has always meant good to so many people. So many people have gone through your hands, and today they see you as a person who is selfless. For us in Rotary, we know you as a person who has given, and we know that part of your CSR from your companies is going to support this campaign, to which you're part and parcel. I'd like to open to the people listening in to ask a question. Experts are here, but even if you have a comment, feel free in the next 15 minutes.
Maybe we can look at the comments and find the question.
We've been following the this one here.
Maybe I can start with the first one. Malaria Free Uganda is a very good initiative. What are they going to do differently to achieve Malaria Free Uganda? Before we had opened up this discussion, I gave an example that tomorrow I'm traveling to Arua to launch a campaign of using the environment as a way of fighting malaria, where we are going to grow over 20 species of trees and others, in making sure that we give them out to these communities where malaria is over 20% as a way of fighting malaria. But we are going to use organizations like Rotarians, who are known to be dependable. They are selfless, they pay to serve, they are not paid to serve. So with our relationship today, and we are having our district governor, current district governor of Rotary, online, our district governor, Rosette Nabumba, to reiterate her commitment in using Rotary in fighting malaria, using Rotary clubs spread all over Uganda. The presence of Rotarians across Uganda, we are going to use them as a resource, as a group of people who are going to promote advocacy, but also to commit resources in the fight against malaria. So the problem and the challenge has been having foot soldiers on the ground, but bringing together the private sector, and the public sector together. We are going to exchange ideas, and we are going to see these challenges in every district and to see how we can tackle it as a case study one by one and find solutions to these challenges. And that is the reason that we have the foot soldiers on the ground, people we are going to use, using Rotary as an example, to reach out to these communities, identify a need, and take action. I think the panelists, you're reading questions. In case any of you sees something you feel you can make a comment about, feel free to answer.
I like, if I may say through you, Chair, I like the comment from Dr. Charles Patureve saying that we should break it down and manage it individually. Break it down: malaria-free Uganda, malaria-free districts, malaria-free constituency, malaria-free villages, malaria-free households. Let's take it all the way down to malaria-free individuals, where people are proud to say that my household is malaria-free, and every district is saying the same.
You're not seeing some people raising their hand. I see someone there. Can you move the screen?
Yeah, a little bit.
Can you mute?
Yeah. Okay. Yeah.
Robin.
Yeah.
Oh, yes. Thank you very much. What an excellent conversation. Robina and I work with what many people have referred to as DFID in this conversation. I think on top of the very good contributions that have been raised this evening, I think mine from a partner's perspective is just to encourage us all, even as we look at resource mobilization, to think about the important component of efficiency. Dr. Diana is a champion of accountability and transparency. So even as we think about increased resource mobilization, just keep thinking, where can we expand the dollars that we have? How can we get the biggest return on investment? So issues about integrated service delivery. So where are the efficiencies within the system that we can use to make sure that even as we look to more financing, which is indeed, very pertinent, we make the most of what we have. Thank you very much, panelists, and I love the energy that is coming through. Over.
Yes, this is Michael Nkama from the Uganda National Oil Company. We're very pleased to be part of this initiative to create a malaria-free Uganda by 2030. What I'd like to commit to, I'm representing Proskovia Nabanja, who's the CEO, and we are basically going to commit to create a malaria-free environment around all our oil field projects, the midstream projects, the refinery, Kabale Industrial Park, East African Crude Oil Pipeline. These are, as we all know, mega projects which will significantly impact, have a very, very significant impact on the economy of our country. And there will be many, many people directly and indirectly involved in those projects. And so we commit to working towards a malaria-free environment in those areas. To give a very specific example, the airport project that is currently underway already has a community outreach program in which the contractor in this monitors the incidence of diseases among the local communities, HIV, hepatitis, but of course the prevalent one is always malaria. And so there's certainly a big opportunity, I think, through these very large projects to reach out and sensitize many populations in the surrounding areas. So as UNOC, we commit to prioritize this within our CSR, but also in our project execution activities as we move forward over the next 5 years implementing these projects. Thank you.
Hello.
Yes.
Yes, good evening.
Good evening.
Thank you for the presentation. I'm into tourism, and we are in safari camps near national parks, and the mosquitoes there are huge, and they bite you as if they are 1.5 kilos. They are heavy, they are big, their bites are ferocious. We need a solution that does not destroy other elements of the environment. And then too, for the general public, we can fight the mosquitoes themselves and the parasites, but if the standard of living is not rising up, without farm gate prices for agricultural produce and fumigations of areas around and people affording basic needs, malaria will continue to be with us. The farmers need farm gate prices for their cassava, for their matoke, to have a sustained level of income. Without fighting malaria for an impoverished society is extremely hard. Thank you.
We'll try to work around communities to see how we can help them.
Is in Moya. That's
Yes.
Moya area. I think we've got to address that.
Yes. And those are some of the areas where we are going to concentrate our efforts first.
Juliet?
Yeah.
Hello, I am glad to be listening in this discussion. Juliet Chokunda from Uganda Biodiversity Trust Fund. This is a very interesting discussion. We believe that everything begins with prioritizing, and ever since we got to understand and committed to joining this group to fight malaria, we have been amazed at how many things we are able to think about, and we are able to factor in the control of malaria. We have been discussing together with my team about the next round of grants. And I was surprised that one of the things that came through is how can we empower the communities close to the protected areas that we're going to work with to be able to factor in and improve on the value chain of maybe producing these oil, insect repellent oils as one of the things that they can invest in, which can give them money, which can help them get more information about how to protect themselves and their families about malaria, and which can also help them get away from the protected areas and destroying the numerous resources that we have out there. So as Uganda Biodiversity Fund, we have agreed amongst ourselves and within the entire board that we will prioritize this, that we will work hard and factor the fight of malaria and fight of these mosquitoes within the work that we'll do. As we promote agroforestry, we will also promote the planting of mosquito repellent plants where people can actually be protected. But we also realized, and I think this is something that I would like to pass on to everyone, that every one of us has a role to play in this. And together, we can make it a success. I know that there are so many hurdles along the way, but even the journey of 1,000 steps starts with a single step. So let's fight one at a time. It's only a healthy population that can be able to grow the food. It's only a healthy population that can be able to go to school. So there are so many interlinkages that we need to work on. And every one of us in whatever sector we are working on can give a contribution towards this. And I know that together we'll look back and pat ourselves on the back. We are committed to this noble cause, and we will walk this journey with the entire team. Thank you.
Thank you, Julie.
Unmute.
Sylvia.
Lily?
Sylvia.
Yeah. Unmute. Yo, oh, you muted again. Unmute. Okay. Can they leave it?
Yeah, thank you with that.
It triggers you from your side.
Unmute.
When you unmute, it brings a notification that the host is.
Trying to unmute, then I
So
think
you have to say yes. But I think she's not saying it.
Yeah, Lily.
Thank you, Ken, and thanks everyone. What a wonderful presentation. I just wanted to re-echo what Patrick said about Uganda being the Pearl of Africa. But there's one thing that has come out very clearly right now from the COVID pandemic, how important health factor plays into the tourism development of a destination. It has become very, very obvious that it's a top priority, but also to point out that every year there is a global assessment of how each tourist destination is keeping up with having a healthy environment. And as a country, we have been doing very poorly. 2019, we ranked 134 out of 140, like from where the sixth worst destination of the 140 that were assessed. So we have a huge task ahead of us, but having a cause to try and break down how we can deal with one of the key health issues, which is malaria, is moving in the right direction. And as one of the leaders in the tourism industry, I can commit. And as the CEO of UTB, right now we are putting a lot of effort in regulating the sectors by inspecting each and every enterprise. And we have a big contribution that we can make towards the malaria-free Uganda through our effort of regulating especially the accommodation facilities. So we'll definitely join in and sensitize the tourism enterprises, and in our regulatory work of the accommodation facilities, we'll make sure that malaria is one of the key things that we will deal with. Thank you.
What I'm meeting?
I'm meeting, but without unmuted here.
Myers?
Thank you, Chair. I would like to thank the great team for the initiative. And as Mr. Patrick Bitature put it, it's the contribution in this charter is not only financial, but also human resource. So there is a bit of intellectual we wish to contribute. Now, I'd like to, as we take up this initiative, like to submit that one, dealing with malaria is like dealing with a madman. You need to hold him by the horns and you tranquilize him. So given what the WR talked about in terms of resistance, resistance is not only for the mosquito or for the parasite, and it's on board because it doesn't need a visa to get resistance from Asia to Africa on the plane or something like that. 50 years, which Patrick talked about, is quite a long time. I would like to open like this, that one, as we take up this initiative, we may need to think beyond the conventional strategies if you have to bring the enemy and give him a blow. So with this team, I commit as somebody who's been in the malaria world for donkey years, that we should work together to make new innovations that should bring this disease in a shorter period than we anticipate. I wish to submit with the presence of Madam Secretary and the Chair.
There's one for Yonas there.
Yeah. Also, let me take this opportunity to thank everyone who has contributed and also the commitment that is coming from different players. Yonas, you're asking what measures are we taking to supervise and ensuring the appropriate use of malaria intervention. As we mentioned earlier, there are different interventions that Ministry of Health is implementing. But we have realized that these are the implementations that we have been, or interventions we've been using over time. And it is only the mad person who does the same way and without change and expect results to be different. So I think we need to look at, to broaden our interventions. And that's why we are bringing in everyone, because we have realized that to fight malaria, it's not just giving mosquito nets alone. To fight malaria, it's not just to do indoor residue spraying for particular households. It's not just enough to do larviciding in a given area. It is actually mass action. It is mass action, and also it is an effort that everyone needs to join in. I like that someone talked about community mobilization and making sure that you get the head of the household to be the champion and to ensure that we break small units. And those small units, once they are successfully implementing the prevention, then they coalesce and they form a bigger part of area that has no malaria. All these interventions we are talking about, for example, planting trees that repel mosquitoes. These are things that you do not need a lot of sophisticated intervention. For example, getting the leaders up to the level of LC1, the village health team, zoning their areas and working each one, making sure that all the interventions of the government that, as far as malaria is concerned, they are actually implemented properly, because we cannot supervise everyone everywhere. We plan, we use government structures, local government, counties, but that cannot work if everyone is not on board. So really the message here is that malaria is not, as actually I like what Juliet said, it requires everyone's involvement, everyone's participation, and not just on the side, but actively. If I have a house, what have I done within my area to ensure that I eliminate malaria? You find some people, even in Kampala here, the garbage that is thrown in our neighborhood, and when it rains, water stagnates somewhere, then it becomes a breeding place. What have we done? What have we done to ensure that everyone plays his or her role? So I think that's the message. Once we have mass action and mass action by everyone, I can assure you malaria will be defeated. Thank you very much. There's Emma.
Emmanuel.
Emma, can you mute and
unmute
himself? You can't.
You can't?
Someone has taken you off the hosting right.
Some hackers came in there. Just wrap up.
Yes, I think we've got some hackers. You'll excuse us. We are going to have our website open. We'll make sure that it is known by each and every one of you. We thank you so much for having joined us. I know you've taken out your time to come and join the Selfless Men and Women. I'd like to thank our panelists. I'd like to thank the Secretariat, staff from the Ministry of Health, headed by our Permanent Secretary. We have Dr. Bayo, who was online. We've worked with him. He has been a very, very good supporter of our initiative. Each and every one of you has made a difference. Your contributions is what is going to make us reach that destiny of announcing a malaria-free Uganda in the next 10 years. We thank you so much to our partners, to those of you who have given us a smile, committing to support this initiative. We're also looking forward to those who haven't said anything. I know I could see some names which had committed as corporates. We are going to reach out to you, and we wish you a very good evening. Thank you.
Thank you so much. Thank you so much.
Thank you. Thank you. Thank you.